important, and you know it will not all be required in the orthopedics or physiotherapy department. These movements is very important even you are a general practitioner. So what are the movements in the joint? Two things you must be clear. One is the movement and another is the axis around which the movements occur. Around, suppose these two, this is the joint, right? So axis is transverse. When something it is down, we call it vertical, and when it like that, we call it transverse or horizontal. So any line which is from superior to inferior in our body, we call it vertical, and when it in this fashion, we call it transverse or horizontal. And there are other oblique and other, this is the line. So every joint we have to know the line. Suppose this is the two bones and it moves in this fashion. So the axis is usually transverse, not usually, always transverse. Around this transverse axis, this move. So is the axis is present in this joint? No. We imagine there is an axis. There is an imagine, this is an axis around which the two bones are moving at the joint. So suppose one bone is moving in this fashion, rotating. So we know that the axis is vertical, around which the bone is moving. Imaginary line, an imaginary line. You must remember, there is no such axis present in our body. We imagine, according to the law of physics, there is an imaginary line passing to the center of the bone, coming out this here, and the joint is moving in this. So in this movement, the axis is vertical. Suppose any joint moving in this fashion, so we assume the axis is anterior-posterior. In such a way, there are two, you must be clear about the movements and the axis in every joint. When you go day after day, it will be very easy to you. So first is the flexion and extension. What is the definition of flexion and extension? I have already told you that movements occurs at the joints. Joints mean union of the two or more bones, usually two or more bones. A single bone joint, it doesn't form the joint. So it may be one bone, this joint, there are joint, there is a two joints, this is the proximal phalanx, this is the distal phalanx. The two bones are involved. But in the knee joint, you look, there are so many bones, femur, patella, and the tibia. So there may be multiple bones, more than two bones can involve in the joint, right? So these movements occur in the joints by the bones, by the action of the muscles, by the how this bone moves, by the action of the muscles. Clear? Now, what is flexion? Suppose this is the elbow joint, humerus and ulna and radius form the joint, and so this is the joint, and we assume that this is the angle of the joint. This is the angle. Angle means what? In geometry, line of meeting place of the two lines. So we call it, this is the angle. Similarly, this is the angle. So there are two definitions of the flexion. Number one, the most important, usually we use when the angle gets reduced. At any movement, when this angle gets reduced. Reduced মানে কি? Lessens, কমে যায়. When this, it is now 180 degree. By this movement, the angle become 70 degree, 90, 30 degree. So the angle is getting reduced, so we can call it flexion. Another definition of flexion, especially in the limbs, you know, in our limbs, there are two surfaces. One is the anterior surface, one is the posterior surface, according to the anatomical position. In case of a upper limb or superior extremity, it is the anterior surface, also we call flexor surface. Flexor surface. Flexor surface. And posterior surface we call extensor surface. Extensor surface. Extensor surface. So by any movement at a joint, if the two flexor surface come close together, we call it flexion. This is the flexor surface of the arm, this is the flexor surface of the forearm. By this movement, two flexor surface coming close together, so we call it flexion. When these two flexor surface go away, we call it extension, just the opposite. But in case of a limb, a lower limb or inferior extremity, this is the, what I am call it, this is the flexor surface, the anterior, but in case of a lower limb, it is just the opposite. It is the posterior is the flexor surface. Remember, in case of a lower limb, posterior surface is the flexor surface and anterior surface is the extensor surface. It occurs, you can easily know when you go to the embryology, there occur rotation of the limbs in opposite direction, so that in upper limb it rotates. You will learn later. It in outward and inner limb moves inward, so that this becomes so. এখন মাথা ঘামাবে না. Just know, in case of a lower limb, anterior surfaces are extensor surface and posterior surfaces are flexor surface. So in case of a upper limb, this is the flexion. In case of a lower limb, this is the flexion, not this. So this is the flexion. This is the flexion, right? This is the flexion. So in case of here, this is the flexion, this is the extension, this is the flexion, this is the extension. In case of elbow joint, this is the flexion, angle gets reduced, this is the extension. In case of a shoulder joint, clear হচ্ছে তো? In case of a hip, this is the flexion, right? This is the extension. Now tell me, there is a tricky word. In case of an ankle joint, do it in your own. What is this movement? Flexion or extension? Huh? Flexion. Can angle gets reduced. And this movement? Extension. But other definition? Here, two extensor surface come close together. This is the extensor surface. This is the, in case of a sole, this is the flexor surface. Then, in case of a lower limb, it is the palm is the, this is the flexor surface. So in case of this is the flexor surface, this is the flexor surface. But this movement, when we do this, two extensor surface come close together. Then কি হবে? দুটোকেই আমরা ফ্লেক্সার বলবো, দুটোকেই আমরা ফ্লেক্সার বলবো, এক্সটেনসার এখানে হবে না। These, in case of an ankle joint, these movements, both these movements are flexors. We call it, and in case of a lower limb, when any movement goes towards the earth, or down surface, we call it plantar. So we call it plantiflexion or plantar flexion because two flexure surfaces are come close together. So we call it plantiflexion, and this we call dorsiflexion. And this movement we call it in dorsiflexion. We call it dorsiflexion. So in all cases, except this ankle joint, you can, what is by two definitions, they are same. But in case of an ankle joint, here we term both movements are flexion. There is a no extension so one movement, when this movement occur, we call dorsiflexion, and this movement we call plantar flexion or short word plantiflexion. ক্লিয়ার হয়েছে? এটা আমরা বলে দিচ্ছি যেহেতু আমরা ওটাকে ডেফিনেশনটাকে মান্যতা দেই দেন অ্যাঙ্গেল রিডিউস থেকে, যার কারণে ফ্লেক্সর সারফেস কাম ক্লোজ টুগেদার সো দ্যাট দ্য নাম ইজ ফ্লেকশন, রাইট? সো এই যে ডরসিফ্লেকশন, প্ল্যান্টিফ্লেকশন, কেমন? সো দিস আর দ্য ফ্লেকশন, দিস আর দ্য এক্সটেনশন। ছবিতে দেখো অনেকে হয়তো so this is the flexion, this is the extension, but in case of ankle joint, this is the plantar flexion, this is the dorsiflexion, and in case of there, this is two flexor surface come close together, angle gets reduced, this is also flexion, but as it occurs in lateral side, not in the midline, we call it lateral flexion. These movements we call it lateral flexion. Now the another word, adduction and abduction. Clear করে নেব একদম, এগুলি এখন স্লো যাচ্ছে, জাস্ট ফার্স্ট ক্লাস বলে, এরপরে যেন ভুল আইডিয়া না থাকে, there will be no wrong conception, otherwise it will be difficult to you understand the relations. Another, so this is the movement, opposite movements, flexion, extension occur around an in particular axis. Another two movements, opposing movements occur around another particular axis, that is the adduction and abduction. Adduction means there must be an axis line, a central line, and from this the movement occur. Adduction usually means any movement where when any movement brought the bones towards the midline, the joint, the bones towards the midline, joint towards the midline, this is the midline, we call it adduction, and when it goes away, we call it abduction. So this is the adduction, this is the abduction in case of a shoulder joint. This is, এটাই খুব একটা হয় না এইখানটায়, look, in the case of a wrist, this is the adduction, this is the abduction, where because in anatomical position it is the midline of our body, midline, and this movement, the bones coming towards the midline. So this movement in case of a wrist joint, this is the adduction, this is the abduction, this is the adduction, this is the abduction, right? Similarly in hip joint, this is the adduction, this is the abduction, this is the abduction because it goes away, knee joint এ খুব একটা হয় না, এইখানে this is the adduction, this is the abduction. In case, now আরেকটা জিনিস ভালো করে শোনো, ফিঙ্গার, ফিঙ্গারের ক্ষেত্রে where is the adduction, where is the abduction? In case of a upper limb, শুধু মিডলাইনের ডেফিনেশনটা নয়, একটা সেন্ট্রাল পয়েন্ট আমরা আগেই বলেছি, একটা সেন্ট্রাল লাইন ধরে নেই, তার এগেনস্টে কি ইউজুয়ালি সেন্ট্রাল লাইন ইজ দ্য মিড লাইন, বাট ইন কেস অফ এ ফিঙ্গার, in case of a finger, we assume a central line. Any finger going towards that line, it is adduction. any finger going away from the line, it is abduction. It is applicable only in the fingers, not in other parts. What is the axis line of the hand? Third finger. The middle finger is the axis line of the, in case of an adduction and abduction, this is the axis finger. So this ring finger, when going towards this is adduction, this is abduction, this is adduction, this is abduction. আবার দেখো এইটা এদিকে যাচ্ছে, ল্যাটারালি যাচ্ছে কিন্তু মিডলাইন কম্পারিজন করলে। If we compare this midline, this ring finger going away from the midline, but it is not abduction, it is adduction. Why? It is going towards the central line. এটা ক্লিয়ার করো। আমি আগেই বলেছি কি midline এ গেলে adduction, away from midline abduction, but it doesn't hold water in case of a fingers. Fingers demands an central and an axis line. In case of a upper limb, hand, the axis line is going through the middle finger or third finger. Finger is counting in this fashion: first, second, third, fourth and fifth. So this is the axis line. So any finger by its movement going towards this middle finger, it is the adduction. Any finger going away, we call it abduction. So this index finger going towards this, so this movement we call it adduction, and this is abduction. It is, if we consider the midline, it is correct. It is going to the midline adduction and going away midline. That is okay, but it is not true for this ring finger or fourth finger. In fourth finger, this is going away from the midline, but still it is adduction. Why? It is going towards the mid axis finger, that is the third finger or middle finger. And this is the abduction. This is the abduction, because though it going medially, but still it is abduction because it is going away from the third finger. Similarly, in case of a ring finger, this is the adduction, this is the abduction. In case of a, though the movements is less in case of a toes, but still there are some movements occur. So what are the axis finger in case of a toe? Second finger. Second finger is called the axis finger. Axis finger of the, in case of a toe. So any finger moves towards the second toe, it is adduction, and any finger away from the second toe, it is abduction. And it is, so in case of a toe, suppose this is the toe, this is the second finger, all this finger going towards the second toe, it is adduction, away from abduction. But in great toe, this is the abduction, this is the abduction. This is the adduction, this is the abduction. So what is the axis finger in case of a upper hand? Third. Middle finger or third. In case of a foot, it is the second finger. বাকিগুলি ঝামেলা নেই। এই দেখো, so ফিঙ্গারের ক্ষেত্রে, and this joint we call it metacarpophalangeal joint. This is the metacarpal bone, and there are three phalanges here. You must remember that in case of a hand and toe, these are bones are present here, 5 bones are present here, we call it metacarpals, and these are called phalanges. In thumb, there are only 2 phalanges, but in case of a index, middle, ring and little, there are 3 phalanges. We call it proximal, middle and distal. In thumb, there is an proximal and distal. So this joint, show me the movements at the metacarpophalangeal joint, means joint between the metacarpal and the proximal phalanx. What is this? This is the flexion, this is the extension, this is the flexion, this is the extension, this is the adduction, this is the abduction. সুতরাং পরীক্ষায় যদি জিজ্ঞেস করতে পারে ওরালে, show me the movements of the thumb. This is the flexion, this is the extension. And adduction টা একটু ঝামেলা আছে. Adduction আমরা বলি এই, away, and adduction. Adduction এই, abduction এই. And in case of a thumb is the beauty, unique feature of an human. Though the apes and other monkeys have got thumb and they have got some movement of the thumb, but human is superior to the other animals, to chede the apes and other orangutan, etc., because not only for the brain but also for he or she is superior due to the movements of the thumb. It is an unique feature of a human being that one movement is present in case of a human, not present in others. What is this movement? We call it opponents. Abduction, adduction, abduction are present. Also a beautiful, peculiar, unique movement are present. We call it opponents. Opponents movement, or opponent movement. What is this? Simple. By the palm of the thumb, we can touch the palm of the other finger. Chimpanzee, gorilla parbe na. And so that we have got a unique grip in our hand, which is not present in the apes and the gorillas, etc. There are three types of grips are present. One is a power grip. Power. We hold any object like this, present in apes. One is a hooking grip, present in apes and gorillas. And another beautiful grip is present in case of a human, this presence of the opponents, so that they can do fine movements, painting, drawing, suta porano, needling threading a needle, everything. So fine movements is present. Come on, সেইটার জন্য human is human and apes are apes, right? And you know, the quadrupeds in superior extremity are also weight bearing. Even in gorilla, they are weight bearing. অনেক মুভমেন্ট করছে চার পায়ে, কোনো সময় দু পায়ে, but human are bipedal. We walk only by toes. We do not use যারা দিচ্ছে, but an evolution আরেকটা কথা আছে, phylogeny repeats ontogeny. দেয়ার একটা কথা রয়েছে, এটা জেনে রাখো। এটা অফ দ্য ওয়ার্ড আমি সাধারণত বলি না। আমরা যে ডেভেলপ করি, কেমন অন্টোজেনি, আমরা যে হিউম্যান ডেভেলপ হচ্ছে ফ্রম জাইগোট টু সব সময় কিন্তু আমাদের যে ফাইলাম থেকে এসেছে, ইভেন ফিশেস ফাইলাম কর্ডারটা থেকে সমস্ত কিন্তু আমাদের শরীর আগে রিপিট হয়। যেরকম সবচেয়ে বিউটিফুল এক্সাম্পল হচ্ছে কিডনি। কিডনি যখন ডেভেলপ হয়, প্রথমে যে কিডনি when the kidney is developing, first kidney mimics মানে কি, likes, অনুকরণ করা, but it looks like very low aquatic animals. Then fishes, ওই রকম কিডনি হয়, ফিশের যেরকম কিডনি আমাদের হয় in earlier months of pregnancy. Then this gradually disappears because this fish kidney is not possible to maintain our load of waste materials to handle this waste material to come out. So nature sees that a kidney hobe na, so it disappears, replaced by reptile kidney. Eo deklo hobe na. Then ultimately our chordata phylum mammalian kidney comes. সুতরাং ফাইলোজেনি রিপিটস অন্টোজেনি, আমাদের যে ডেভেলপ করছি সেইটা অন্টোজেনি ডেভেলপ যেটা করছি সেটা ফাইলোজেনি অর্থাৎ ফাইলাম যেটা রয়েছে আমাদেরকে রিপিট করছে সব সময়। গিলস, আমাদেরও কিন্তু গিলস হয় মাছের মতো। দেন গ্র্যাজুয়ালি আমাদের রিকোয়ার্ড নেই, বিকজ লাংস আর ডেভেলপ, ওয়েল ডেভেলপ, সো আলটিমেটলি দে ডিসঅ্যাপিয়ার, দে ফর্ম ডিফারেন্ট আদার সাব ম্যাটার্স, রাইট? সুতরাং সবসময় ফাইলোজেনি রিপিটস অন্টোজেনি। আমাদের বাচ্চারা যে হামাগুড়ি দিচ্ছে সেই তখনও ওয়েট বিয়ারিং হচ্ছে 4 পায়ে, আলটিমেটলি দরকার নেই, দেন ইট গ্র্যাজুয়ালি উই বিকাম বাইপেডাল, অ্যান্ড অ্যাট দ্য কস্ট অফ বাইপেডাল there is some plus and minus point. What is the plus point? In case of a shoulder joint, plus point is that we do so many different movements which the other animals cannot. We do everything. We can branch এটা করতে পারছে, গরিলাও পারে, কিন্তু গরিলা or apes cannot draw paintings and cannot do the fast bowling, right? Or bowling, even spin bowling also. So what's happened? This become good thing. We do so many things. Leonardo da Vinci, Picasso will not develop, will not appear, they become not much famous if this is not present. But at the cost of this, we sacrifice the stability. The dislocation of the superior or shoulder joint is very rare in quadrupeds. একটা গরুর সামনের জয়েন্ট খুলে গেছে দেখবে না, কিন্তু আমাদের অকেশনালি প্রেজেন্ট। So we sacrifice the stability at the cost of mobility. The terms রয়েছে, যাক এটা অফবিট কথা হয়ে গেল, শুধু এইটুকুনি বললাম। তাহলে শুধু এই to make it impress that there is a beautiful movement present in the thumb that is known as the opponent's movement, by which pulp of the distal phalanx of the thumb touch the pulp of the distal phalanx of the other finger. This is known the opponent, only present in human. আরেকটা মুভমেন্টস আছে এখানে, especially some joints which we call circumduction. সার্কামডাকশন শুধু শোল্ডার জয়েন্ট অ্যান্ড হিপ জয়েন্টে আছে তাই নয়, অনেক জয়েন্টেই আছে, এই জয়েন্টেও আছে। সার্কামডাকশন মিনস কি? when all these movements, flexion, extension, abduction, adduction and rotation are combined together to form a movement and this movement is moving the limb or moving the bones as an arc of a circle, where base is represented by the distal part of the bone. কি হলো ব্যাপারটা? বেশ মাথাটা গুলিয়ে গেল, খুব সিম্পল জিনিস, ওই ডেফিনেশন দিতে গেলেই কঠিন হয়ে যায়। কিছুই নয়, এই দেখো একটা মুভমেন্ট যেটা ফাস্ট বোলার করছে বা বোলার করছে। এই যে এখানে দেখো ফ্লেকশন, এক্সটেনশন, অ্যাডাকশন, অ্যাবডাকশন, এরকম কিছুটা রোটেশন হচ্ছে, এই যে মুভমেন্ট হচ্ছে। এবং দেখো এইটা একটা, এই যে আমার ডিস্টাল পার্টটা একটা আর্ক অফ এ সার্কেল করছে। কল্পনা করো একটা আর্ক অফ এ টোটাল সার্কেল, বেস অফ এ কোন করছে। কোনের এটা হচ্ছে এপেক্স বা আর্ক অফ এ সার্কেল অথবা বেস অফ দ্য কোন বলতে পারো। ইউ ক্যান টেল দিস ইজ দ্য বেস অফ দ্য কোন। দেখো একটা কোন করছে, করছে তো, এই কানটা সার্কেল করছে, এই মুভমেন্টটাকে বলে সার্কামডাকশন। এই যে এই দেখো একটা বেস তৈরি করছে, এপেক্সটা হচ্ছে এখানে, বেসটা হচ্ছে ওখানে অ্যাজ এ কোন। সুতরাং সেই মুভমেন্টটাকে বলে সার্কামডাকশন, এখানেও হয়। সুতরাং these are the movements. আচ্ছা, রোটেশনের একটা বলা হয়নি, যখন রোটেশন, এই শোল্ডার জয়েন্ট একটা রোটেশন হয় ভার্টিক্যাল এক্সিসে, যখন এই সাইডে ঘুরছে টুয়ার্ডস দ্য মিড লাইন, এটাকে বলি ইন্টারনাল রোটেশন অর মিডিয়াল রোটেশন। যখন ল্যাটারালি ঘুরছে তখন আমরা বলি ল্যাটারাল রোটেশন অর এক্সটার্নাল রোটেশন। সিমিলারলি ইন কেস অফ হিয়ার, দিস ইজ দ্য মিডিয়াল রোটেশন, দিস ইজ দ্য ল্যাটারাল রোটেশন। ল্যাটারাল ফ্লেকশন বলেই দিয়েছি, it is present only there and also present here also. Lateral flexion of the trunk, lateral flexion of the trunk. Adduction, abduction. Oh, bhulei jetam. This is the beauty of this PowerPoint. আমি এটা বলতেই ভুলে যেতাম যদি না এটা থাক। Supination and pronation, very very important. Supination pronation না থাকলে আমরা খেতেই পারতাম না। উই ক্যান, দেখো এভরি মুভমেন্ট, আরেকটা কথা জেনে রাখবে যে নেচার ইজ ভেরি মেজার। প্রচন্ড কৃপণ যদি কেউ থাকে হোল্ড বিশ্ব ব্রহ্মাণ্ডে, সে হচ্ছে আমাদের নেচার। এর মতো কৃপণ একটা এক্সট্রা জিনিস দেবেন, আবার যখন দরকার দে উইল গিভ। সুতরাং কৃপণ বলবো না, মোস্ট কি বলবো, সবচেয়ে কি বলবো বলো, হ্যাঁ দ্যাটস গুড। সুতরাং সবচেয়ে প্রুডেন্ট, সবচেয়ে মানে হিসাবই হচ্ছে নেচার। যেখানে দরকার একটা এক্সট্রা দেবে না। আমাদের কি হয়, পয়সা থাকলে উই ডোন্ট, দেয়ার ইজ এ নো হাঙ্গার, বাট স্টিল উই টেক এ পিজা, উই টেক এ রোল, সামথিং ইউজলেসলি। আমরা পয়সা থাকছে, আমার একটা মোবাইল রয়েছে, উই ক্যান পারচেজ অ্যানাদার মোবাইল জাস্ট টু স্যাটিসফাই আওয়ার ক্রেভিংস। অ্যান্ড জানো, যখন কোনো জিনিস কিনি, দেয়ার ইজ এন সিক্রেশন অফ ডোপামিন ফ্রম আওয়ার ব্রেন হুইচ গিভস এ স্যাটিসফ্যাক্টরি রেজাল্ট। এটার জন্যই অনেকেরই খুব কেনার ইচ্ছা থাকে। এটা কিন্তু একটা মানে নিউরো বায়োলজিক্যাল মানে রয়েছে, যারা কেনে পছন্দ করে, দেয়ার ইজ এন রোল, এক্সেসিভ ডোপামিন সিক্রেশন হয় এবং তার জন্য একটা প্লেজার পায়। সুতরাং কিন্তু নেচার নয়, যেখানে দরকার দেবে, যেখানে দরকার একটা জিনিস এক্সট্রা দেবে না। এইখানটায় কভারিং দিয়েছে লাংসকে, ভেতরের দিকে কোনো কভারিং নেই, দরকার নেই, কারণ এখান দিয়ে লাংসটা ইনজুরি হতে পারে। নেকের কাছে এই আমাদের লাং, নট অনলি ইন দ্য প্রেজেন্ট ইন দ্য থোরাক্স, এ পার্ট অফ দ্য লাং ইজ pipped out here in the lower part of the neck, which we call the apex of the lung. Apex of the lung. So lung not only present in the thorax, a part of the lung is present, a upper part of the lungs, a conical projection, conical part of the lung is present here, and there is a chance of injury in this lung. So that nature gives a strong fascia, strong membrane to protect it, known as Simpson's fascia. Only in this side, not inside. Inside a projection kothay. All lymph node, sorry, কি বললাম, yes, all lymph node present in our body, or lymphatic organs, lymph আসবো এই মধ্যে, has got capsule to give him protection. But the lymph organs present within the gut wall, no, there is a no capsule. Why? কেন রাখবে? গাটের ওয়ালটাই তো প্রোটেকশন দিচ্ছে। সুতরাং বুঝে দেখো যে এভরিওয়্যার নেচার ইজ সো প্রুডেন্ট, সো মাইজার আমার নয়, মানে সো বিউটিফুল। সিমিলারলি এই যে মুভমেন্টস আমরা খেতে পারি, তার জন্য একটা স্পেস দরকার হয়েছে, দেবে। সো গিভ এ অ্যানাদার টাইপ অফ মুভমেন্ট known as the supination and pronation, and in case of a lower limb, inversion and a eversion, two very unique movements. Supination means ki by any movement, when by movement it is not the lateral flexion, look, lateral, sorry, lateral ki bolchi, abduction, abduction means this, abduction means this, direct one axis. Supination like a rotation movement, so that palm is looking forwards in anatomical position. This is known as the supination. এবং এখানে radius and ulna, আগেই বলেছি, radius and ulna two bones lying parallel with to each other. এইখানটায় রেডিয়াস এবং এখানে আলনা lying parallel to each other and the palm looks forwards. এই মুভমেন্টটা কোন জয়েন্টে হয় কে বলবে? এই যে মুভমেন্ট করছি আমি সুপাইনেশন, এই মুভমেন্টটাকে বলে সুপাইনেশন। এবং অপোজিট মুভমেন্ট, so that palm looks backwards as if some picking something, we call it pronation. We call it pronation. কোন জয়েন্টে হচ্ছে মুভমেন্টটা? হ্যাঁ, এলবো জয়েন্ট। তুমি নো, এটা ভুল। ইভেন ইন ফাইনালে গিয়েও করে, ফাইনালে গিয়েও করে। লুকস, it looks like it occurs in elbow joint, but it never occurs in elbow joint. It occurs in radio ulnar joint. পরে পড়বে proximal, middle and distal radio ulnar joint হবে, পরে পড়বে তোমরা। সো আজকে থেকে জেনে রাখো, pronation and supination never occurs in elbow joint. এইটা শুধু জেনে রাখো, আর যেন ভুল না হয়। সিমিলারলি, এবং বুঝতেই পারছো এই যে মুভমেন্ট প্রোনেশন করছি, এটা কিন্তু আমাদের ফিডিং এর জন্য ইম্পর্টেন্ট। যেমন আর ওয়েট ক্যারি করার জন্য আমাদের সুপাইনেশন ইম্পর্টেন্ট। স্ক্রু টাইট, আমরা স্ক্রুই টাইট দিতে পারতাম না ইফ সুপাইনেশন ইজ নয়। দেখো আমরা সুপাইনেশন করছি, লুক আই এম ডুইং সুপাইনেশন, এন্ড সুপাইনেশন ইজ স্ট্রঙ্গার মুভমেন্ট দেন প্রোনেশন। তো করে দেখো নিজে, সুপাইনেশন ইজ ভেরি স্ট্রং মুভমেন্ট, সো দ্যাট স্ক্রুয়ের ডাইরেকশন এমন ভাবে করা হয়েছে যাতে এই সাইডে স্ক্রুগুলি টাইট হয়, এইদিকে খোলে। আমাদের মোর ইম্পর্টেন্ট স্ক্রুটা টাইট করা, খোলাটা নয়। কারণ টাইট না হলে যদি ইফ ইট ইজ এ লুজ, ইট মে বি ডিট্যাচ। সো দ্যাট supination is that in this fashion, and screw is such a are designed in such a fashion that when screw is moving in this fashion, it gets tightened. Come on. So this is supination, this is pronation. In case of a lower limb, when this sole, এটাকে যেমন বলে palm, এটাকে বলে dorsum of the hand, এটাকে বলে palm, এটাকে বলে dorsum of the hand. In case of a lower limb, when the sole looks inwards, এই যে এইদিকে এই যেমন করছি, এটাকে বলে ইনভার্সন। এবার কাউকে যেতে যেতে পট করে একটু পাটা দেখিয়ে গেলাম, হ্যাঁ, কেউ বুঝতেও পারলো না, এরকম। অ্যান্ড দিস ইজ নোন অ্যাজ দ্য ইভার্সন। এবং এটাও কিন্তু অ্যাঙ্কেল জয়েন্টে হয় না, পরে পড়বে। এটা মিড টার্সাল জয়েন্টে হয়, পরে পড়বে। এই যে অপোজিশন এবং যখন ফিরে আসে রিপোজিশন বল, সাবজেক্টে ঢুকে যাচ্ছে। সুপিরিয়র এক্সট্রিমিটি, উই স্টার্ট আওয়ার ডিসেকশন অ্যান্ড আওয়ার পার্টস বাই দ্য সুপিরিয়র এক্সট্রিমিটি। This is, superior extremity, any extremity consists of skin, bones, fascia, muscles, nerves, veins, lymphatics, etc. Right? So before going to that, this is the superior extremity, and you peculiarly to know that this breast, though present in the thorax, but it usually anatomically included in the superior extremity. So, বুঝতে পেরেছো? ব্রেস্টটা কি মনে হয়? থোরাক্সের পার্ট। আমাদের কি কি পার্ট রয়েছে? সুপিরিয়র এক্সট্রিমিটি, যেটা পড়তে হবে, ইনফিরিয়র এক্সট্রিমিটি, তারপরে অ্যাবডোমেন, থোরাক্স, হেড, নেক, অ্যান্ড আলাদা করে পড়তে হবে ব্রেন। এটা হচ্ছে আমাদের পার্টস। আমাদের পার্ট এক্সামিনেশন হয়, এরম ভাবে পার্ট দিতে হবে। আমাদের স্টার্ট হচ্ছে সুপিরিয়র এক্সট্রিমিটি দিয়ে। সো দো ব্রেস্ট লুকস লাইক it is present in the thorax, but actually it is under the control of the superior extremity. জায়গায় যাব না। Skin of the when we go to dissect, ভালো করে শোনো, this is the skin, and there is a fine line present in the skin. We call it slightly oblique, ভালো করে দেখলে বুঝতে পারবে, we call it Langer's line বা Langer's line. What is the importance of the Langer's line? It represents the collagen fibers present in a particular direction. Importance key, if we cut or give an incision, surgeon, along the Langer's line and you stitch it, the marks, stitching marks will be very minimum, sometimes absent. So surgeon prefers to give incision along the Langer's lines, but sometimes it is not possible. হয় না। সুতরাং একটা কাস্টমার হচ্ছে আমরা এখানে ধরো যদি কোনো কারণে পসিবল হয় আমরা ল্যাঙ্গাস লাইন দিয়ে ইনসিশন দেব, তাহলে কি হবে, আমরা অপারেশন করবো, যদি স্টিচ করি স্টিচটা প্রায় দেখাই যাবে না, উই ক্যানট সি দ্য স্টিচ মার্কস। সুতরাং দ্যাট ইজ দ্য ইম্পর্টেন্ট অফ দ্য Langer's line, and actually it represents the direction of the collagen fibers present underneath the skin. ছেড়ে দাও। When you cut the skin, we find a tissue, looks like a yellowish or whitish cotton wool type, very fine film of wool, cotton, very film of cotton, খুব পাতলা কটন করলে যেরকম হয় সেরকম আমরা পাবো, and we call it superficial fascia. We call it superficial fascia. Superficial fascia. আমরা সুপারফিশিয়াল ফাসাটাকে সরিয়ে দিলাম, অল্প স্ক্যালপেল দিয়ে কেটে দুপাশে সরিয়ে দিলাম। দেন উই ফাইন্ড এ স্ট্রং মেমব্রেন লাইক ফাসা, এরকম ভাবে একটা ফাসা পাবো। সুপারফিশিয়াল ফাসা সরালে এই রুমালের মানে নয়, মানে মেমব্রেন লাইক ফাসা, হোয়াইটিশ ফাসা, স্ট্রং, নট উলি লাইক এ সুপারফিশিয়াল ফাসা, উই কল ইট ডিপ ফাসা। We call it deep fascia according to nature, according to the definition which is present superficially and it is present underneath the superficial fascia, we call it deep. Deep fascia, which not only binds the whole superior extremity in this fashion but also gives some projection. এবার একটা কথা আছে অ্যানাটমিক্যালি প্রায় বলবো প্রলongation বা প্রজেকশন ব্যাপারটা কি। প্রজেকশন মানে হচ্ছে এইটা ধরো ডিপ ফাসা, এরকম ভাবে এইটা হচ্ছে ডিপ ফাসা, এখানে সুপারফিশিয়াল ফাসা ছিল, সরিয়েছি, আমরা সরিয়েছি, এরপরে আমরা দেখতে পাচ্ছি যদি পুরো ডিসেকশন করি সুপিরিয়র এক্সট্রিমিটিকে, উই ডিসেক্ট হোল, উই ফাইন্ড দিস টাইপ অফ মেমব্রেন বাইন্ডিং দিস underneath all the structures. We call it deep fascia. We call it deep fascia. And a part in different regions, deep fascia gives some septum. Some part of the deep fascia goes inside. বুঝতে পেরেছো? Dividing this compartment into number of small compartments. Not only that, this compartment sometimes bounds the bones together, bounds the nerves together. We call it prolongation of the deep fascia, right? Or projection of the deep fascia. আমরা এবার deep fascia को scalpel দিয়ে কাটলাম। স্ক্যালপেল দিয়ে কাটলাম, তারপরে আমরা দেখব মাসেলস। Muscle is covered by a prolongation of the deep fascia. We call it perimysium. পরে শিখবে, এগুলি মাথা ঘামাবে না করে। এবং মাসেলের মাঝে বা মাসেলের তলে, মাসেলের ওপরে উইল ফাইন্ড দ্য আর্টারিজ, দ্য ভেইনস অ্যান্ড দ্য নার্ভস। এবং লাস্টে মাসেল যদি when you separate the muscles or cut the muscles, reflect it. আরেকটা কথা হচ্ছে reflection. What do by reflect it? When you push aside any muscle, any structure, we call it, we reflect this part. We reflect the muscle. We cut a muscle and move along. We call it reflect this part. Come on. If we cut a muscle or reflect it, we find then bones. Right? So this is the more or less general of the bones. Now, you must remember that in the superficial, these arteries are present in the deeper structure. In case of a superior extremity, main artery is here is the axillary artery, brachial artery, then it divides into, brachial artery gives two branches, it divides into like a river, it like a river, and here the river becomes divided into two sub branches, we call it, which goes the radial side, we call it the radial artery, and this goes with the ulnar artery. These are the main artery present in deeper region along with the muscles, either super deep to the muscle or by the side of the muscle, sometimes in front of the muscle. These are the deep artery. These deep artery and also veins are present. Now one thing you remember, এটা আজকে clear করে নাও। This is the heart. Heart gives a main artery known as the ascending aorta, arch of aorta, then it goes to give thoracic aorta, then abdominal aorta, and from there branches come, So artery gives branches. So suppose this is the brachial artery. Brachial artery divides into two branches. One is the ulnar artery, one is the radial artery. Artery ke amra short e eram likhi. So ulnar artery and radial artery are the branches of brachial artery. So brachial artery gives branches. So direction of the artery is in this fashion. And these artery then goes and ultimately divides small branches, smaller branches, we call it arteriole, then it gives capillaries. Already you know in your 12th classes, the small capillary. From this capillary, tributaries of the vein start. The small vein now join together from the larger vein, then this joint vein, this is the more larger vein, right? লেখা যাচ্ছে না, more larger veins. So direction of the vein in this fashion, opposite to the artery, and vein does not give branches. We call it, suppose it is the brachial vein, we call it, these artery are the tributaries of the brachial vein, right? Tributaries, তুমি যদি বলো যে brachial vein, কেমন, radial artery, radial vein is the branch of the brachial vein, total 0. Radial vein is the tributary of the brachial vein. Radial vein is the tributary of the brachial vein. Clear হয়েছে? Radial vein is the tributary of the brachial vein. Artery ক্ষেত্রে কিন্তু branch. বুঝতে পেরেছো? Brachial artery gives two branches known as the radial artery and the ulnar artery. Vein ক্ষেত্রে ulnar artery, ulnar vein and radial vein join together to form the brachial vein. সুতরাং যখন আর্টারি ডেসক্রাইব করবে, সো গিভ ব্রাঞ্চে, তোমাকে একটা কোশ্চেন দিল, ভালো করে এটা শোনো, তোমাকে একটা কোশ্চেন দিল, রাইট এ শর্ট নোটস অফ দ্য রেডিয়াল আর্টারি, কি লিখবো? রেডিয়াল আর্টারি ফরমেশন। রেডিয়াল আর্টারি ইজ এ ব্রাঞ্চ অফ দ্য, ভালো করে শোনো এই জায়গাটা, প্রত্যেকে শোনো, রেডিয়াল আর্টারি ইজ এ ব্রাঞ্চ অফ দ্য ব্রেকিয়াল আর্টারি অ্যারাইজিং এট দ্য কিউবিটাল ফসা। এই জায়গাটাকে বলে কি হয়েছে, ছেড়ে দাও। কি বললাম? রেডিয়াল আর্টারি ইজ দ্য ব্রাঞ্চ অফ দ্য ব্রেকিয়াল আর্টারি। কিন্তু যদি বলি ব্রেকিয়াল ভেন লেখো, কি লিখবে? যে আমার টাইম নেই, আমি বলেই দিচ্ছি। brachial vein is formed, so radial artery is a formation is here. Radial artery formation is here. Then it goes in this fashion. বুঝতে পেরেছো? হ্যাঁ, formation is here, then it describe, then it goes downwards along the flexor superficie, এরকম ভাবে বলতে বলতে then it ends by এখান গিয়ে শেষ হয়েছে, পরে শিখবে। কিন্তু যদি বলে brachial vein কি, জাস্ট উল্টো, brachial vein is formed here and it goes upwards, then join together with the radial vein to ends by forming the brachial vein. ক্লিয়ার হয়েছে এটা? ভেনের ক্ষেত্রে কিন্তু ডাইরেকশন উল্টো, রেডিয়ালের ক্ষেত্রে, রেডিয়াল আর্টারির ক্ষেত্রে অরিজিন এখানে, এন্ড এখানে, ভেনের ক্ষেত্রে অরিজিন এখানে ডিস্টালি অ্যান্ড এন্ড এখানে। আর্টারির ক্ষেত্রে ব্রাঞ্চ, ভেনের ক্ষেত্রে টিবিউটারি। brachial vein is not the branch of a radial vein, is not the branch of brachial vein. অবশ্য ঠিক brachial vein বলা হয় না, ভেনিকমিটেন্টেস অফ দ্য brachial artery বলা হয়, সেটা পরে শিখবে, আমি সহজ করার জন্য এখন বললাম। আমরা সাধারণত ভেনিকমিটেন্টেন্স অফ দ্য brachial artery বলি, কেন বলি সেটা নেক্সট ক্লাসে বলবো।
Okay, so two long questions we have already answered. One is isomerism of classification of carbohydrate. Second is isomerism of carbohydrate. Now, next short question from this chapter is role of dietary fibers. Correct? The dietary fibers are those which we cannot digest. These are mostly polysaccharides, but which we cannot digest. Raffinose, barbacose, these are also dietary fibers. Right? But they are shorter, small in size. But mostly dietary fiber means cellulose, lignin, pectins, etc. Now these comprises a good amount of a percentage of composition of the vegetables. So a person who is on the diet or regime to reduce weight for weight reduction program, going through weight reduction program, he is advised to take more and more dietary fibers. Now this is number one. Okay. What are the other points, other important functions of dietary fibers in our body? Number one, it provides feeling of fullness, so it reduces calorie intake. Number one. Number two, it due to its particular structure, it absorbs a lot of water, so it swells up as it passes through the large intestine, and this swelling up triggers the peristaltic or segmentation movement of the smooth muscle, which in turn keeps the bowel movement active, so it reduces or prevents constipation. This is the background information. Third one, since it absorbs a lot of water, so what happens if there is any toxin in the diet, then it gets diluted. It's called biodilution. Correct? So the toxin as a whole, if it is present in dry state, it counts for 1 milligram. But when it is diluted in the bulk of stool, now it is 1 in 100 ml or 200 ml or 500 ml of fluid. So naturally its concentration decreases, and so its rate of absorption. So our body gets naturally more time to get rid of those toxins. Correct? Number three. Number four, it reduces calcium absorption. It reduces, cholesterol absorption, particularly fats, lipids, cholesterol absorption. Right? What I told by mistake, that's also correct. We'll come to that later. So it reduces, suppose we are taking a lot of fatty food, and along that we are taking a lot of vegetables, then it will reduce the absorption of fat from gut, and that way it will help us to prevent coronary artery disease or hypercholesterolemia. Clear? The cholesterol in our body comprises, made up of two parts. One, endogenous cholesterol production, another is exogenous cholesterol production. Now exogenous cholesterol production counts only 30% of the total cholesterol of our body. Endogenous cholesterol is maximum. So when a person wants to reduce the cholesterol in the blood or body, he should go both ways. Curb out the cholesterol intake by taking more and more dietary fibers along the food and the diet, and number 2, apply some medicine and drugs which will inhibit the endogenous production of cholesterol. Correct? So, by this way we can curb out the entry of cholesterol into the body. Fine. Now, apart from these good effects, this dietary fiber has got bad effects also. Suppose a person is suffering from iron deficiency. These dietary fibers will grossly reduce the iron absorption. In addition to iron, it will also reduce the absorption of zinc, calcium, other dimetal cations, dicationic metal ions. Right? So, these are the functions of dietary fiber in our body. Structure of cellulose, it is like beta 1,4 glycosidic linkage, continuation of a long chain. Now, we come to the next big group of heteropolysaccharide called mucopolysaccharides. This comes as a long question. Well, this is a diagram taken from Lippincott. The best concise way to read mucopolysaccharides should be, according to me, should be from Lippincott. This diagram is taken from Lippincott. So, here in this diagram, we have shown several types of mucopolysaccharides. Now, first thing first, you just go through what are the names. Meanwhile, I will explain you the definition and other functions also. Now, this mucopolysaccharides refers to those group of compounds or heteropolysaccharide which comprises of a repeated dimer unit of one acidic sugar and one amino sugar. Mostly a repeated dimer unit of one acidic sugar and one amino sugar. Now, this definition you will find here. Correct? Now, few of them can be sulfated, few of them may not be sulfated. Those who are sulfated, they are called charged mucopolysaccharides. Those who are not sulfated, they are called uncharged mucopolysaccharides. Charged means they are usually negatively charged. Sulfate is negatively charged. Uncharged means no charge. So, one of the example of uncharged mucopolysaccharide is hyaluronic acid. Is there anyone who has ever heard hyaluronic acid before this class? Yes? Which part? Covering of the ovum. Very good. So, hyaluronic acid is an example of uncharged or non-sulfated mucopolysaccharide. Rest all are mostly sulfated. Correct? Now, we will come to the different names or the properties first. Properties of GAGs. Now, GAGs, the first time I am telling this name, term GAGs, mucopolysaccharides, GAGs, proteoglycan. There are several names. There are closely related names. Are they similar? Are they equal? No. They are closely related names. We will come to that slowly. Now, mucopolysaccharide means I have defined. What are GAGs? Mucopolysaccharide is equal to GAGs. Correct? What are proteoglycans? Mucopolysaccharide is equal to GAGs, glycosaminoglycans. What are proteoglycans? One or more GAGs will make proteoglycan. Correct? When more than one type of GAGs will combine, they will form proteoglycan monomer. When such monomers will comprise, they will form proteoglycan polymer. Clear? So, what is GAG? Is equal to mucopolysaccharide. That is nothing but a polymer, heteropolysaccharide made up of a repeated dimer unit of one amino sugar and one acidic sugar. Fine. Now, different types of GAGs will combine to form proteoglycan monomer. When proteoglycan monomer binds with one hyaluronic acid chain, it forms, see, this is these small threads like here, they are all gag chains, say chondroitin sulfate, dermatan sulfates, heparan sulfate, heparin, etc., etc. The green colored, this line is nothing but a core protein to which they are attached by this linkage, trihexosyl linkage, trihexosyl linkage. Fine. So this is core protein. Each joining point has been shown here. Now this looks like a bottle brush, the brush used for cleaning the bottle for the babies, infant bottles, feeding bottles. So they do look like that. When you see from the top, it looks like they are like sun rays, they are arranged. And when you see from the side, they are like parallel to each other. Fine. Now this is how it looks like from top view, from side view. The core protein to which they are attached, usually they are attached through CH2OH, that is serine side chain. Correct? Serine or mostly serine or threonine. Fine. Now this is a proteoglycan monomer. See this one. And when such many monomers are joined to this blue color ribbon, which is hyaluronic acid, we call it proteoglycan polymer. Now, is it very much clear to everyone? When I say gags, what do I mean to say? When I say proteoglycan, what do I mean to say? When I say mucopolysaccharide, what do you want to say? Correct? Is it clear? All mucopolysaccharides are gags. Sorry, all gags are mucopolysaccharides, but all mucopolysaccharides may not be gags. So mucopolysaccharide can be used equal to gags at this level. No harm in it. Is it clear? Fine. Any question from these structural features of gags? You need to draw the diagram and explain by labeling them. That's all. No need to write in essay form. Make your answer as concise as possible, as simple as possible. This is clear. Now we move on to the properties of gags. Now properties of gags being, most of the gags being negatively charged, they have an effect, attracting effect over water molecules. So they cling to a lot of water molecules. Where do you find water molecules? Between the structure of these hair-like structures, these chains of gags. Between these gags, a lot of water molecules are trapped. Between these gags, a lot of water molecules are trapped here, 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 here. Now, where do you find these compounds in our body? Any example? Which tissue? Almost all tissue contain some or other parts of mucopolysaccharides. Most commonly is a joint, synovial fluid, vitreous humor, everything. Now they possess this. What is the speciality of our joints? These joints, we can move it back and forth whenever we want. It's not like that it is like this, it is fixed and then we have to move it and then we can do like this. No. So they can, this is called what? We can move it, flexibility of the joint. Now this flexibility of joint depends on two bones coming closer to each other and going away from each other and doing it again and again. Right? Now this particular property is depends on this particular property of gags. It's called resilience of gags. Resilience of gags. Resilience means stubborn. Resilient means stubborn. One who defies the forces to change itself. Opposes. No, I don't want to change. It's called resilient. So these gags are highly resilient. Means when you press it, all the water molecules are excluded from the structure, so they are compressed. But due to negatively charged, they do not get stuck with each other. Whenever the force is withdrawn, the pressure is withdrawn, they again move apart from each other. And the water molecules then re-enters into the structure, and that's how it makes it slippery. It can slide on one another. That's why we can move joint without having any pain. When this property is lost, we have osteoarthritis. When does it happen? Usually at older age, when the cartilaginous tissue fails to produce these particular gags and secrete in the synovial joint. Correct? So this is a diagram to explain resilience of glycosaminoglycan. Now before I go to this particular diagram, I want to explain a little bit more about the difference of the two terms, glycoprotein and proteoglycan. In proteoglycan, in both the cases, the amount of carbohydrate is less and amount of protein is more. In both the cases, whether it is glycoprotein or proteoglycan. But in proteoglycan, in glycoprotein, it is less than 10%. The amount of carbohydrate in glycoprotein is less than 10%. But both are made up of protein and carbohydrate. Clear? 10% rule, let me remember. So now these are proteoglycans. These are proteoglycans. So we have to remember like this. The first two structure are chondroitin 4-sulfate and chondroitin 6-sulfate. Next is dermatan sulfate. Next is creatine sulfate. Next is heparan and heparin. Same structure. Last one is hyaluronic acid. So let us try to, you have to remember not only the names, their composition, their bonds, everything. So no hiding. Can you see from this distance? Huh? Remember this sequence CDKH. C stands for chondroitin sulfate, D stands for dermatan sulfate, K stands for creatine sulfate, H stands for heparin or stroke, heparin and heparan sulfate, H stands for hyaluronic acid. There are possibly two types of chondroitin sulfate. One is chondroitin 4-sulfate and another is chondroitin 6-sulfate. If the sulfate group is attached to the fourth position, then we call it as 4-sulfate amino sugar সঙ্গে থাকতে হবে. And if the carbon sulfate is attached to 6th position of carbon, then it is called 6-sulfate. Both are functionally both are same. Fine. Now comes composition. See the composition. GLCUA and this is GalNAc. Fine. Now the next dermatan sulfate, this will come here. See, GLCUA, GalNAc. This is same chondroitin sulfate. This one, what is there? GalNAc is there, but this one is changed. Now, is there anybody who can tell what is the structural difference between glucuronic acid and iduronic acid? The right side remains same, the left side changes to glucose to iduronic acid. Anyone? Glucuronic acid and iduronic acid are epimers at C5. Just revert the direction of OH at C5. It becomes L-iduronic acid. It becomes L-iduronic acid. This one will be in L form. Fine. What is next? So can you remember this one remains same, GalNAc, N-acetyl galactosamine, N-acetyl galactosamine. This one changes. So if we can synthesize chondroitin sulfate by introducing 5 epimerase, one simple enzyme, we can convert it into dermatan sulfate. Remember, that kind of enzyme is there in the body. Iduronic acid, GalNAc. Now this one is creatine sulfate. What is special here? Some variation from the general definition of mucopolysaccharide, which says is a repeated dimer unit of one acidic sugar and one amino sugar. Here it violates that law. We have pure sugar and one amino sugar. Acidic sugar is missing, correct? Such small variations are there. So, keratan sulfate K means gal, and this is what? Exchange. The gal comes here, glucose goes there. See, crisscross. GLC UA becomes GLC NAC. Gal NAC becomes gal, removing or except NAC. Clear? You have to remember this sequence, then only you can remember the diagram. You know? If you can remember this chart, you can draw the diagram on your own. Fine. Let us move on to next one. Now, keratan sulfate, after keratan sulfate comes heparin or heparan sulfate, this one. Now, what is the difference between heparan sulfate and heparin? Heparin is more sulfated than heparan sulfate. That means the compound which has got sulfate in its name actually contains less amount of sulfate. The compound which has sulfate in its name actually contains less amount of sulfate. If heparan sulfate is sulfated at 3 position, it becomes heparin. If heparan sulfate is not sulfated at 3 position, it remains heparan sulfate. Clear? What is the composition? Remember, unique. Both are glucose. Both are glucose. Heparin. Keratan alone galactose and GLC NAC. Heparan glucuronic acid and glucosamine. Glucuronic acid and glucosamine. Both are glucose. Glucuronic acid and glucosamine. Heparan, sulfate and heparin. Next comes hyaluronic acid. What is present there? What is there? GLC UA. What is there? GLC N, mean N glucosamine. And this one GLC UA, same. This is GLC NAC, means it started with glucose galactose, ended with glucose and glucose. It started with one glucuronic acid and galactosamine, ended with both glucuronic acid and N-acetyl glucosamine. Now, after we know the composition, now we have to remember, just go through this composition. You should by heart it. If you cannot remember now in this class, it will be very difficult to recall after class, I tell you. First, you remember the sequence C, D, K, H, H. Then you remember what is the major components. GLC-UA, GAL-NAC. Right side remains same, left side changes to hyaluronic acid. Then galactose comes here, crisscross, K for crisscross, K for cross. So galactose come here, glucose goes there, right hand side. So this is N-acetyl galactose plus N-acetyl glucosamine. Then both glucose, glucuronic acid, glucosamine, and then both glucose, glucuronic acid and N-acetyl glucosamine. Clear? Now we start with bonds. Can we off? beta, alpha, beta, alpha, beta. সিমিলারিটি কি আছে? বিটা আলফা, বিটা আলফা, বিটা অল্টারনেট, তারপরে কি হবে? 1 3 1 3 1 3 1 3 1 4 1 4 1 3 1 3 1 3 1 4 1 4 1 3. Clear? Is it okay? Now you can remember. See, classrooms are not like your school classrooms here. Here we are not going to teach you what. See, there are so many YouTube classes who speaks better than me, whose content of class is better than my class. Doesn't matter. So why do you need classroom? We need classroom for this live interaction and these small things which will help you to note down whenever you collect or you go through any class after this class, particularly this class. So you can understand when you read. So this is how you remember. Fine. Now what next we have to remember? The location, site. Where do you find these particular mucopolysaccharides or gags? In which part or which tissue? Chondroitin sulfate means it is found in mostly cartilages, joints, synovial joints, synovial fluid. Correct? D for derma. It itself speaks where do you find it. Correct? Creatine sulfate. Little different. Heart valves, blood vessels, etc. Okay, they are found on all these tissue. Then heparan sulfate on cell surface. They work or they function as cell surface receptors. Heparin, they are secreted by or from mast cells. Where do you find heparin in our body? They are endogenous anticoagulant. Where do you find location? আরে ওরা ওখানে বেরোলো, তারপর কোথায় পাওয়া যায় কোথায়? At the site of injury, then injury will never heal. Injury will never heal. বলো interstitial space at the lining of the tissue, organs, at the lining of the organs, tissue. Correct? It is not found in blood. If it is present in the blood, then our blood will never clot. Heparin is rather used as anticoagulant for collection of blood in the vial. Correct? Next, hyaluronic acid, mostly they are found in all associated tissue, wherever the strong tissue is there, tensile tissue is there. Okay, it may be skin in association with other gags, it may be vitreous humor in association with other gags, it may be synovial fluid in association with other gags. Clear? And from plus 2 knowledge you know, and the covering of the ovum. Now, next comes mucopolysaccharidosis. Mucopolysaccharidosis or doses. Mucopolysaccharidosis or doses. Now, you might have heard about one particular subcellular organelle called lysosome. You heard of it? Lysosome? Okay. What is the function of lysosome? It is called switched back. What is the function? Raise your hand and tell me clearly. Yes, it is an hydrolytic enzyme. No, it is not a hydrolytic enzyme. Lysosome is not a hydrolytic enzyme. Anyone else? Huh? That is lysozyme. This is lysosome. Huh? It stores hydrolytic enzymes. Wrong. Anyone else? It is called digestive. Okay, fine. But anything else? How does it digest? Autophagy. So what does it store? Lysosome is a membrane bound or membraneless? Huh? So membrane bound. What does it store? Think and tell. What does it store? Last bench. What is found stored inside lysosome? Intact lysosome. বুঝতে পারলাম না, জোরে বল। If I say it contains hydrolytic enzymes, do you agree? It contains hydrolytic enzymes. Do you agree? No, you should not agree. It contains inactive precursors of hydrolytic enzymes. Correct? It does not store any hydrolytic enzyme. It stores inactive precursor of those hydrolytic enzymes. They are not active until they are out of lysosome. If they are active within lysosome, then lysosome, why lysosome alone, whole cell will be digested. So lysosome stores, this is a very good MCQ to make you fool. Lysosome stores inactive precursors of hydrolytic enzymes. It stores trypsinogen. It stores pepsinogen. It stores procarboxypeptidase A. It stores procarboxypeptidase B. Clear? It also stores many of the enzymes which are responsible for breakage or hydrolysis of many of the biomolecules. Say this kind of biomolecules, such a long biomolecule, mucopolysaccharide, they should be turned over again and again repeatedly. Now this mucopolysaccharide, after their function is done, should be digested and should be salvaged, means we produce a new one from the old components. Clear? But this digestion will take place inside lysosome. So if due to genetic error, small mutations in our DNA, those enzymes are absent, then one or more enzymes, absence of one or more enzymes will lead to such conditions where those particular mucopolysaccharides will be accumulated within lysosome. This particular process of accumulation of undigested mucopolysaccharides is called lysosomal storage disorders or mucopolysaccharidosis. It may occur with glycogen metabolism, it may occur with fat, lipid metabolism, then we call it as sphingolipidosis. If it occurs with glycogen metabolism, we call it glycogen storage disorders. Correct? Ultimately, they all come under lysosomal storage disorders. Whenever any hydrolytic enzyme is missing due to genetic mutation. So due to genetic defect, one or other enzymes which cleave these particular mucopolysaccharides may go missing in different individuals. So they will suffer from a disease which falls in a group of diseases called mucopolysaccharidosis, DOSES, or sometimes it is also written alternatively DOSIS. So dosis or doses, both are same. Now here are few enzymes have been shown. The naming and all, don't try to write. You cannot write. There are so many. I will tell you. First, we need to remember the common features of these diseases. Now, these are genetic disorders, they are called MPS. The necessary enzyme is missing. Excessive accumulation of mucosal in the body tissues leads to certain disorders, certain symptoms. What are those? Skeletal deformity, bone deformation, correct? Mental retardation, low IQ, low intelligence, decreased life expectancy. Why? Because mucopolysaccharide are found in heart valves, so they might die due to heart failure. Corneal opacity. Why? They are found in vitreous humor, skin, everything. So they have, some diseases may have visual problems, some diseases they don't, some have. Correct? These are the cardinal features or major features of mucopolysaccharide dosage. Examples, names. Just remember some names. What are the names? Hunter, Hurler, Sky, Sanfilippo, Morchio, and this one? Pronounce it? Huh? How do you pronounce Bordeaux mixture? Bordeaux mixture? Bordeaux. Same way, Mortu, Lamy. Huh? French name. Like Bordeaux mixture, similar way, Mortu, Lamy. Right. Spelling is difficult, pronunciation is good, easy. Now we differentiate them. Let us symptoms, detailed symptoms. Can you remember this one? The National Organization for Rare Disorder, NOD, type 1, type 2, type 3, type 4, 5, 6, 7, 8 is missing, then 9. Hurler syndrome, Sky syndrome. Why? Two are together. Answer is here. This is one, see, two diseases. Actual classification is, if you go through Harrison's Internal Medicine, you will find it is MPS 1H, MPS 1HS. H means Hurler, HS means Sky. Clear? Then comes 2. 2 has no such division. Then 3 has division. See, Sanfilippo, how many? A, B, C, D. 4 types of Sanfilippo. Correct? So which one is better? Correct? But this is also better for, because all 5 fingers are not equal. We have boss, we have tail also. So that boss will remember, tail will remember. Whatever feels better to you, you remember. But at least write 2-3 names. That's all. We'll be happy. Few names. Okay? Fine. So Sanfilippo 4 types. All enzymes differences there. At least remember this enzyme, first 2 enzyme you must remember, type 1 and type 2. Type 1 and type 2, Hurler and Hunter. These 2 you remember. Okay. Rest all you need not to, you may not remember, doesn't matter. At least first 2 you remember. As if I remember everything, but just now I forgot when you're writing in the examination. মনে করে এসেছিলাম এই ভুলে গেলাম, আমরা বুঝি সেটা, we'll give marks. It's not possible. Unless you are into pediatrics, you cannot remember all this. Moreover, these diseases are very rare in Asian countries. So unless you go for PLAB, USMLE, outside, these diseases will never come to your syllabus or in your eye. Okay. So this one, fine. Okay. Now this Hurler syndrome. Remember, whenever you study or you remember any genetic disorder, also remember their class whether it is autosomal recessive or autosomal dominant or হ্যাঁ সেক্স লিঙ্কড এক্স লিঙ্কড ঠিক আছে, এটা মনে রাখতে হবে। সো AR মিনস অটোসোমাল রিসেসিভ। মেটাবলিক ডিফেক্ট কি হবে? ডিফিসিয়েন্সি অফ এনজাইম L-iduronase। কি কি সিমটমস হয়? শর্ট স্ট্যাচার, হাইটে ছোট হবে, সিভিয়ার মেন্টাল রিটার্ডেশন, ভেরি পুয়ার IQ, নেভার উইল পাস ইন এ ম্যাথস পেপার। ওকে, thick coarse facial features with low nasal bridge, এই nasal bridge নিচু হবে। Then full lips, thick lips, thick large tongue, বড় হাফ প্রোট্রুডিং টাং হবে এবং ভারী হবে, কথা বলা জড়িয়ে যাবে, ভালো করে কথা বলতে পারবে না। ইনক্রিজ বডি হেয়ার, হার্সুটিজম বলে তাকে, বডি হেয়ার বেশি থাকবে। আম্বিলিক্যাল হার্নিয়া, আমরা জানি আমার রেক্টাস শীট থাকে এখানে একটা স্ট্রং মাসেল which holds up all the contents of the abdomen, correct? যেহেতু these fascia, these muscle coverings are made up of dermatan sulfate and keratin sulfate, so in missing of those, these fascia will be loose, so there will be herniation, means expulsion of the content of the abdomen through umbilicus. It is called herniation. So when it occurs through umbilicus, we call it umbilical herniation. When it occurs through inguinal canal, we call it inguinal herniation, right? So umbilical hernia. Deafness, why deafness? We hear due to the cartilages, incus, correct? 3 cartilages. So these 3 cartilages will be stiff. Without their free movement, we cannot hear, so there will be deafness. Stiffness in joints, synovial joints will be dry, so there will be stiffness in joints. Shortness of breath, why? Trachea, made up of the same material like cartilages, correct? The shortness of breath. Abnormal bones, spine and claw hand. Claw hand মানে due to stiffness of the joints, claw hand এরকম হবে, correct? And one is missing here, that is corneal opacity বলেছি, বলা হয়নি না, এটা ঠিক বলে দিচ্ছি। Corneal opacity 1HS, X-linked, এটা কি ছিল 1H টা? autosomal recessive, 1HS Hunter syndrome, type 2 DDI, X-linked Hunter syndrome, X-linked coarse, thick facial features, progressive stiffness, decreased mental development. This is C, hepatomegaly and splenomegaly. Hunter and Hurler, the major difference between these 2 diseases, always remember, a hunter cannot hunt without seeing, correct? So eyes will not be affected in Hunter's disease. If the eyes are affected, vision is affected, then it is Hurler's disease. This difference, always remember, this is a differentiating point. That's all. Last bench, any doubt? It has nothing to do. Yes, any doubt, any question? Then let us discuss the important questions from this chapter for final. Number 1, long questions. The probable long questions is number 1, classification of carbohydrate, number 1. Number 2, isomerism of carbohydrate. Number 3, structure, composition and function of mucopolysaccharides. Structure, composition and function of mucopolysaccharides. Hello? Short question. Structure, function, relationship of glycogen. Structure, function, relationship of glycogen. reaction of iodine with starch and glycogen. আরেকটা ইম্পর্টেন্ট ভুলে গেছি পড়াতে, মনে পড়লো, মিউটা রোটেশন, হ্যাঁ, উইথ আয়োডিন, মিউটা রোটেশন, এটা পড়াতে ভুলে গেছি, এক্ষুনি পড়ে দিচ্ছি 5 মিনিট। মিউটা রোটেশন, ঠিক আছে ঠিক আছে, নো প্রবলেম। মিউটা রোটেশন হলো, আচ্ছা শর্ট কোশ্চেন হবে ল্যাকটোজ ইনটলারেন্স, এটা পড়াতে ভুলে গেছি, মনে করিসনি কেন? ল্যাকটোজ ইনটলারেন্স, short note. Mucopolysaccharidosis, short note. The lactose intolerance is due to deficiency of lactase enzyme, যেটাকে বলা হয় বিটা galactosidase activity, beta galactosidase enzyme বা lactase enzyme. Now this enzyme is mostly deficient among the Asian population. Caucasian population usually do not show any deficiency of, মানে কি নাম, টম ক্রুজ, সিলভেস্টার স্ট্যালন, আর্নল্ড শোয়ার্জনেগার, they can drink and digest milk at this age, but you and I may not be able to drink but cannot digest, may not be able to digest milk at this age, because Asians have more lactose intolerance compared to Caucasians. সাহেবদের থেকে আমাদের দুধ হজম করার ক্ষমতা একটু কম থাকে, হলো। আর কি থাকে? The infants who suffer from this lactose intolerance, they cannot be given mother's milk. Why? Mother's milk contains lactose. If they are given mother's milk, fed with mother's milk or cow's milk, I told yesterday cow is our mother, so cow's milk, or auntie's milk. Who is auntie? Goat. Correct. So if we are fed with mom's, auntie's milk, we cannot digest if we have lactose intolerance. The baby suffer from certain disorders. What is that? Number 1, bloating বা ব্লোটিং, উচ্চারণ যাই করো, BLOATING, ব্লোটিং বলে। ব্লোটিং মানে পেট ফাঁপা, পেটের মধ্যে সাউন্ড করবে টপ 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 টপ, তাই না? ফ্ল্যাচুলেন্স, পেটে গ্যাস হবে। ইনডাইজেশন, হজম হবে না। এবং এগুলোতে এই তিনটে হলে কি হয়? ফোর্থ ওয়ানটা ওয়াটারি স্টুল, ডায়রিয়া, তাই তো? এই 4টে সিমটম বলতে হবে, 4 সিমটমস। কি বললাম? ব্লটিং, ডায়রিয়া, ফ্ল্যাচুলেন্স, ইনডাইজেশন, তাই না? তাহলে প্রথমে হবে কোনটা? ফার্স্ট উইল টেক প্লেস ইনডাইজেশন, তাই তো? কেন হবে ইনডাইজেশন? বিকজ ল্যাকটোজ ইজ ডেফিসিয়েন্ট, সো ল্যাকটোজ উইল রিমেন undigested in the small intestine. When it will pass to large intestine, মানে যখন ক্ষুদ্রান্ত থেকে বৃহদান্তে প্রবেশ করবে, তখন কি হবে? তো জাম থেকে জান হতে, ঠিক আছে? আচ্ছা, তাহলে ফার্স্ট হচ্ছে ইনডাইজেশন ডিউ টু ল্যাকটেজ ডেফিসিয়েন্সি। যখন when it leads to large intestine, it will, because it is osmotically active molecule, undigested lactose, it will draw water towards it. Now our anal sphincter and urinary sphincter, these two are different. The urinary sphincter can hold the pressure of liquid, anal sphincter can hold the pressure of solid. Now liquid stool cannot be held back by anal sphincter. So what will happen? Frequent passage of watery stool, বারবার যেতে হবে। বাচ্চা তো বারবার যাবে না, ওখানেই করে বারবার। আমাদের থোড়াই হয়, বাচ্চাদের হয়। পেশেন্টের এজ মোস্টলি ইউল গেট পিডিয়াট্রিক কেসেস, তাই তো? খুব রেয়ারলি বড়দের ল্যাকটোজ ইনটলারেন্স হয়, তখন তারা নিজেরা ম্যানেজ করে শিখে যায় বাথরুম যাওয়ার ব্যাপারটা, ঠিক আছে? তাদেরকে বলতে হয় না, ঠিক আছে? হয়ে গেল। তাহলে এটা গেল, this is a reason for diarrhea due to indigestion. Now what is the reason for bloating and flatulence? The flatulence or bloating is due to accumulation of gas. Why? The large intestine usually contains a lot of normal biological flora, intestinal flora, bacteria. Flora means bacteria. So they feed on lactose and they produce carbon dioxide. They produce carbon dioxide. Unless you are, remember, unless the food contains sulfur containing substances, there should not be any bad smell. There should not be any bad smell. So the babies will pass only smell-less gases. That is mostly CO2. Mostly CO2. Correct? Fine. So the bloating and flatulence is due to production of CO2 from undigested lactose fermentation. হয়ে গেল? These you should remember for lactose intolerance. Now what is the therapy or treatment? Provide lactose-free milk. Provide lactose-free milk. That's all. How long? As long as he is only relying on milk. The moment waning starts, means he starts taking the outside food, you can remove the milk. And milk products. What type of milk products? Can he take payasam? Yes, no. কোনটা? Payasam. পায়েস কি খেতে পারবে? পারবে না। ক্ষীর? না। Curd? Yes. Curd contains no lactose, it is a fermented product. Yogurt? Yes. Paneer? Yes. Correct? Fermented product from the milk they can have because lactose is utilized by the bacteria during the process of fermentation. হয়ে গেল? ঠিক আছে।